The opioid epidemic is the most serious public health crisis I've seen in Maine in my lifetime. It is a true medical disaster. What do we do? Well, the thing I've learned in working intensively on this since I've been in the Senate and since this has really overtaken us in the last few years is there's no single answer. The big gap, in my view, in Maine is treatment. Particularly medication-assisted treatment, which seems to be the most successful alternative. We're having one death in Maine per day. And across the country, it's something like 4 or 5 an hour. Just in the few minutes that I'm spending with you tonight, somebody across the country is going to die. And it's largely preventable. Providing additional funds for treatment, providing access throughout Maine, not only in Bangor and Portland and Lewiston, but in the rural areas where this has been particularly serious, has got to be one of our highest priorities. PCHC is a key player in delivering these treatment services and by the way, fantastic services you deliver to the people in your region generally. We have to understand that this is a disease. I want to really thank the people at PCHC for what you've been doing, what you are doing, and what you will continue to do, I know, to help us with this awful, serious problem in Maine.
Addiction is a primary disease of brain circuits that affect memory, motivation, emotion, and reward. Our high-level brain controls give way to misplaced, primitive survival drives, the same drives that would lead us to do almost anything or take almost any risk to get water if we were dying from thirst.
4 of 5 heroin users actually had an initial experience with an opioid before they went to heroin.
It's not a character flaw, it's not a moral failing, it's a disease, the pathophysiology of which is well understood and the treatment of which is known with as much success as our treatment of other chronic diseases like diabetes or hypertension or heart failure.
The CSI committee was formed in 2013 in response to just the overwhelming substance use disorder issue in the state of Maine as a way to help providers understand what responsible prescribing is. So one of the things that CSI prides itself on is educating providers about evidence-based prescribing. We've had a 60% reduction in opiate and benzo prescriptions organization-wide.
I have also developed our own controlled substance initiative here, modeled after the PCHC Controlled Substance Initiative group, that has really helped our primary care providers to work with patients who come to us on controlled substances. It's really nice to have all of the organizations working together to help improve the health of our community.
CHAMP Clinic has been really a prime example of most of our values of PCHC: collaboration, innovation, access, quality. It's a program in which babies who are born drug affected with neonatal abstinence syndrome because they've been exposed to these substances during their pregnancy.
We are on our 62nd baby that we've seen. So we've seen 62 babies to date. It has been very successful for these families because the babies are usually out of the hospital within 10 to 15 days as opposed to 25, 30, 35 days. I think that one of the really important successes of the clinic also is the collaboration that happens between the different departments within PCHC, Eastern Maine, and then in the community we work with public health nursing and Maine Families and DHHS. So all together we wouldn't be able to have the program without each of those pieces, which has made it be really successful.
Work with naloxone has been, for me personally, among the most gratifying work that we've done because this drug, this medication saves lives, and those lives have value and potential. And we've worked with the Bangor Police Department, with the Bangor Fire Department, with the Brewer Police Department, with the Penobscot County Sheriff's Department to train their staff and help them also obtain Narcan to be used in situations that they come upon where somebody's overdosed and needs to be revived, resuscitated. The Bangor Police Department, even in the first few months, had multiple examples of overdose reversals with the naloxone that they were able to obtain through our mutual collaboration.
What was happening was they were coming across people on their duty that had overdosed, and what they would have to do was they would call 911 or they would call the fire department or call the ambulance. And so we had police officers who were just waiting on site and were not able to do anything for the people that they found. And they knew what the problem was, but they were not trained in the administration, nor did they have access to the medication. It took us a short amount of time to partner with the different law enforcement agencies, get all of the officers trained, get them access to the medication. And now all of the law enforcement agents in our area actually carry nasal naloxone on their person. So just like somebody with an allergy has an EpiPen, we look at naloxone as the same thing. You have a risk of exposure, which could cause you harm, and there's a medication that can reverse that. So we want to make sure that we have this out in the community.
PCHC is in the process of finalizing agreements with the state of Maine and the Penobscot County Jail to begin to offer women in jail evaluation for opioid use disorder and ongoing group psychotherapy treatment while they're in jail.
The largest growing population that we have is our female population. In that female population, more than 90% of them are in jail because of some type of substance abuse related crime, most of which are opiate charges or opiate addiction. And what really impressed me as the sheriff was there was a real effort to talk about the counseling. And the counseling and treatment piece were as important, if not more important, than medication itself. The sheriff's office taking this stance to say that we want to support treatment and recovery and prevention and not just the enforcement part is a clear example that we've changed our mindsets in how we address those that have a serious disease such as opiate addiction. This is a great example of everybody being on the same sheet of music and really creating a program that I think is going to be very successful.
We are very lucky at PCHC to have two practices that started prescribing buprenorphine for those with opioid use disorder many years ago. They did this with little or no community pressure, no fanfare, just doing their job with no judgment, recognizing that addiction really was a primary care problem and should be treated in the community of primary care.
So our contribution really has been one of learning from our mistakes and offering our experience to the other emerging programs and some of the existing programs at PCHC to make them better, more responsive, and contributing to our overall knowledge of the treatment of opioid use disorder.
We find that most family practice doctors are really fearful. Everyone's overwhelmed, they're overloaded, they're working very hard, and the thought of dealing with this high-need population is often really intimidating. But we have found that it's one of the most gratifying, important part of our mission, and the doctors here love the work, working with the addiction program.
We've been really successful now at increasing the access in our brewer clinic, and we're looking at how do we, continue to expand access now that we have the opportunity for nurse practitioners and for PAs to get their what they call their X waivers to be able to prescribe Suboxone. That's going to increase access even more.
A year ago, we received a HRSA expansion grant to support expansion of access to treatment for opioid use disorder, medication-assisted recovery, and we're working to increase the availability of and access to the best models of medication-assisted recovery that we know of. We expect in this year to expand to a program at Helen Hunt Health Center in Old Town, and then ultimately to all of our practices, so that people have as much access to this within PCHC as possible.
PCHC has worked with Maine Health Access Foundation for a while on issues related to substance abuse and the opiate epidemic in Maine. There are so many of PCHC's programs that are consistent with many of MEHAF's programs. One of the things that's been so remarkable and that we hope we'll be able to call upon in in our work going forward with the addiction care grants is just the incredible dedication that PCHC has shown to addiction care, the opiate epidemic, management of chronic pain, and they're real leaders in this work. We're very, very excited to be able to fund their work and the expansion of their work.
It has been an absolutely remarkable experience to see this community come together with the leadership of all of its major healthcare institutions to confront a crisis that none of us would have been able to deal with individually.
The Community Health Leadership Board is made up of area hospitals, social service, and public health providers. EMHS is involved, EMCC is involved, Acadia Hospital, PCHC, St. Joseph's Hospital, CHCS, Eastern Area Agency on Aging, Penquist, and the health department. So that is a great collaborative that, we've built trust over the past 2 years. We've worked together. We have been in the past competitors. So the fact that we can work on a really deeply entrenched social issue together and make very real and meaningful change, that's pretty amazing.
So everyone had a different agreement. So patients would potentially be able to go to one place, decide they didn't really like what they were hearing from that provider, if they were asking them to try to taper off of their opioids or use alternative, safer mechanisms to treat their pain, they would potentially go somewhere else and try to get their opioid medication from another clinician.
It's been a great experience just participating in this collaboration. I've learned a lot from the other providers. We've had a lot of ideas which were thrown around and discussed and argued and different points of view, and I think we are all better for that actually, for working together as a group to address this severe problem.
PCHC has been a partner with us from the start. One of the biggest initiatives that we've engaged in the community over the past few years has been advocating for the development of what's known as a social detox center. PCHC, in its role with the Community Health Leadership Board, has been one of the strongest advocates in terms of helping to make that happen.
It's taking a community effort, and that community effort is happening right now.
We know that we were, the medical community, was at least a part of the problem when it comes to prescription opiates. And now we've taken the responsibility to be the solution as well. So that's a great thing to do.
Again, I just want to thank PCHC for what you're doing, for what you have done, and for what you're doing to save lives in our communities. I'm going to work with you. Let me know what I can do to help.